Good morning. Dr. Nelson Vetanze, welcome you again to the YouTube videos. Thank you so much for all your response, both the good and the bad. The bad responses make me do better and question what I do. The good responses, I just say thank you, and I appreciate you watching. It's November 12th, 2013, and we have a new patient in today that was just referred for unrelenting low back and leg pain. And before I start the process, I wanted you to see, these are the patient history forms. The back of the patient history form. This is the informed consent form. Okay, this is a copy of this young man's license. This is the progress sheet filled out by the patient on every visit. Okay. This is a copy of his MRI that goes in the file. Dr. Vetanze, why are you showing us these forms? These are the legal forms that you need to take care of every patient, federally, potentially state, law. These are the forms that by January of 2014 must be turned to electronic billing records. Must. So understand, all you that are watching this now, you chiropractors, you have to convert to electronic billing records or start paying huge fines or not get paid by insurance companies. This applies to some of you, that doesn't apply to others. Okay, this office is converting to, after my investigation and research, a company called Seamless. I highly recommend that you look into it and benefit from their incredible system. These forms have to be done. So I have today Keith Robinson. Could you walk for me a little bit, Mr. Robinson? I know, I'll take your water. Yeah. Okay, that's good enough. I think we have the idea. Now, I've never seen Mr. Robinson before, have I?
Nope.
And we talked before, because he's never seen me either, and the type of treatment I have for this potentially very serious condition where a man can't ambulate, he can't sleep, can't use his legs, he's in misery. I'm a little aggressive, like, Doc, what are you going to do? And before he was here, we had some Bronco football players come in, and I'm drop tabling them and adjusting them and slamming them around, and I see his eyes got a little big, like, oh my God, is he going to do that to me? So what I talked about with Keith is I'm going to try to heal him from the outside, and then so he can heal from the inside. You have to heal from outside, and you have to heal from inside. For all you patients that are going to chiropractors getting adjustments, but you're not really getting well like you should, or like you feel as quick as you should, you're not healing from the inside. Now, you're not healing from the inside because the inside energy isn't turned on to heal you. So either you're sick and you got something else inside preventing you getting well, or the adjustments you're getting aren't good enough to release the healing energy from the inside to heal you. But God gives your body the power and the energy to heal itself. All we are is servants to God to tell us innately what we should do to turn the power on so you can heal yourself. Remember, you have to heal from the outside, you have to heal from the inside. There are various chiropractic techniques. If it works for you, wonderful. If it doesn't, you have to search for other techniques and other providers who do a better, more efficient job than the most they can for you to get your result as quick as possible. The MRI, obviously chiropractors and people watching it, Keith has a low back situation with leg numbness to the right leg, also left hip pain, numbness and tingling, and it's been there for a long time. It got worse when he's as a star center fielder, went over to catch a ball. Catch it? Did you catch it?
Yeah, I go.
He got the ball, but he hadn't played since because he hurt himself. Well, he did a certain movement, twisted something, likely threw something out of alignment. So what? We'll find out. Now the MRIs are here. And I'll expand on it one time so you can see it. But you know, I had new hip put in March, and if I could buy this MRI for my back from Keith, I would pay him for it. Because my MRI is much worse than his. I look at this MRI, and what 60-year-old man, excuse me, I revealed your age, what 60-year-old man, woman doesn't have arthritis of their spine, doesn't have desiccation, doesn't have a spur, doesn't have a disc? Come on. Don't judge your treatment by MRIs. That outcome has been very unsuccessful by orthopedic neurosurgeons, whatever, and I'm sorry, that's the case. My MRI is 5 times worse. I'm okay, not perfect. You can't, the pain doesn't come directly from what you find on X-ray and MRIs. You're going to look at an X-ray, MRI and see nothing, and somebody's like, oh man, I'm in incredible pain. Yet you're going to have other MRIs that are miserable, and the guys say, oh, people say, I feel pretty good. Why? Because it's the body healing inside out, taking care of you. Your body's trying to heal you every day. Some can heal better, some can heal worse. So I look at the MRI and said, well, there's no tumors, you're not dying of cancer, there's no fractures. Let me see what I can do, Keith. Did I forget anything that we talked about? It's pretty well here, right?
That's it.
All right, and then Father, Son, and Holy Spirit, let's go to work.
Amen.
Face down for me. I hope Keith gets better after I treat him, or he'll never make the YouTube, and it would be disappointment, all the stuff I just said, all right? So he's prone. Okay, bend this leg. Any pain?
No.
Okay, bend this leg.
Oh.
Pain?
Yes.
Where? In front. Okay, bend both legs now. So we bend both legs, and we have actually more flexion on the right side and less range motion on the left side. Okay, yet it doesn't hurt here, but it hurts here, but it pulls in front, sort of like a positive Eli's, but it's more right in this area in front, right of your groin.
Yes.
Yes? Okay.
And around.
And around into here. And that's where it hurts, right? So I'm going to go get my percussion hammer. If you patients don't know, this is a percussion hammer, and there are many variations. Chiropractors and MDs use it to test reflexes. We have a reflex. We have an equal reflex. If he had deadening nerves, okay, that the nerve was dead or dying, I wouldn't get a reflex of the deep tendon reflex on the Achilles tendon. But I got actually a small reflex, but I got it both on the same side. Good start, good sign. Could you lay on your back for me real quick? Well, real slow, and I'll help you. I'll stand by the table. If he falls, he can fall towards me. Now understand, patients, as you see this is a man that has either sacroiliac, lumbosacral herniated disc, bad hip, something causing him intractable pain, and you can't live this way. You can't live on drugs. Don't live on drugs. Turn to something else, find an answer. If you have to, it's unfortunate, but do all you can not to. Let's go to his legs. Jerry, can you see this? All right. Okay, as I touch his feet here, Jerry, I got about an inch shortness in the left lower extremity. See? Left foot, leg, shorter than the right. I'm going to raise this leg up, young man. Now, as most of you chiropractors, all you chiropractors should know, this is a straight leg raising. So I'm stretching the sciatic nerve. In a true disc, Mr. Keith, my friend here, will be coming off the table breathing fire, because that nerve pain would be so hot, you absolutely can't tolerate it. Not so bad though when I raised that leg, was it? No, great, thank you. Okay, raise this leg. What? Where's the pain?
There's no pain now.
Well, when you start coming up, you felt it on the right side. So when I raised his left leg, I got about 3/4 of the way up, he felt pain on the right side. Why? Because the right side contracted in its antagonistic movement to take care of the leg coming up on the left side. Okay, so it's not a primary positive test for herniated disc or nerve root compression on either side. Bend your knee. I'm doing this a little out of sequence, everybody, but when I start my treatment, I'll go into sequence. Gravitational pattern adjusting, GPA. Thank you, Dr. Schutz. Okay. Internal rotation of the left hip, of the right hip. Oh, that's about 75 degrees. Tell me what happened.
The pop right here.
Right here. So as I'm moving him around, he didn't feel the pain in the back, he felt it right in the front. Clue. Keep it in your mind. All right, internal rotation, not bad. But when I turn it this way, you feel it in groin?
No, I feel it back here.
Now he feels it on external rotation of the femur. He feels it in the buttock, probably gluteus medius, piriformis, whatever. Another clue, all right? Bend this one. External rotation, rotating this leg out. Internal rotation. It's stuck though, isn't it?
Yes.
Okay, it doesn't hurt, but it's stuck. So we have an internal rotation restriction on the left side. The left side. So we got some clues, all right? And I'm going to help you up. I need you to lay face down again. Here's what I feel. I feel he's going to get well because I'm going to change things about 10 millimeters in his sacroiliac, maybe in his pelvis, the socket of his hip, the acetabulum. And I hope it'll help him. Should. All right, scoot down my way a little. Good. All right, so bend your knees. So it's not, well, interestingly enough, the right short leg, can you see this? Where the right short leg, now we got a left short leg. In extended position like so, we got a left short leg, about a ½ inch. But when I do this, we got a left short leg. So we got a positive deer field. To me, that's non-compensating. There's a complication somewhere along the mechanism of the spine gravitationally and structurally that's not giving me a finding I'm supposed to get. It's a red flag. So let's do this. Would you turn your head to the right, please? Would you turn your head to the left, please? Okay. He turns his head to the left, and the left short leg becomes a ½ inch long. That's a positive deer field. That means there's a situation in the neck. I want to fix the neck before I come to my gravitational, the system I use for compensation. Left rotation. I'm sorry, on your back again. And I'm right here standing by you. Right. Do you mind if I took this off?
Go ahead.
You good? All right. So left cervical rotation balanced out the legs because the sacrum and the occiput work hand in hand. So by me rotating the occiput and the neck, I affected the sacrum, which caused the change in the leg lengths. Had nothing to do with the discs, but there's definitely a relationship. So I'm going to turn your head left and just relax. Come on, relax. Very nice. All right. Now turn your head left for me again. The other left. Okay, and right. All right. Mr. Keith's sweating a little bit nervous about me right now, so we have to get him to relax a little bit. Okay. Should I get you a glass of wine or a beer in him? No. All right, let's do this so I don't have to bend down. Lloyd tables, the best. Turn your head again to the left. Let me go a little lower. I'm going to use positive form. Back and forward, back. Oh, thank you. That'd be the one. Okay. Now, sir, you're probably going to feel better after that. And you're not going to know why or how did he do that, but you're probably going to feel a little better. Come on up for me on 3. 1, 2, 3. Now lay face down for me again. Was that a little easier?
It was.
It was. Oh, how's that possible? Now, how's that possible that I haven't touched his low back yet, but I found the positive deer field in left cervical rotation, corrected it, and I adjusted C1, C2 to the left, correcting the upper cervical, having the occiput sit more correctly, and now he turns around and says, Doc, my pain wasn't so much. About That's how great chiropractic can be. If you practice chiropractic efficiently and completely, not just one adjustment to the neck, not just an activator to the sacrum, they're all good techniques, but it's complicated. Be the complicated chiropractor. Know the system. Don't be calling patients up saying, hey, you need to come in and see the doctor. He was wondering about you. They should be calling you, lining up. When you have to call them, you better figure out what you're doing because you're doing it wrong. All right, let's go back. Interestingly enough, Jerry, can you see this? The legs are even. Okay, bend your knees. Even. So the positive dira field is gone. I took away a complication that if I didn't do this test to find out that was there, I would never have done it. Wonder if that's the missing link, that after I'd give 50 adjustments, he's still not well because I didn't do a dira field and knew it existed. It was a complication of the normal compensatory findings. Blah, blah, blah. That's the way it works. Okay, now let's go up your spine. Sir, I'm going to put your right hand right here. Right over his right hip. Put your left hand here. Okay? Which one's high? Okay, let's do it again. This is this one, this was this one. I feel this being low and I feel this being high. Can you all see that? You can actually tell by the elbows. Feel it now? This elbow's out more and flared because this side is higher and he has to reach back. This elbow's lower because he reaches down. So the high elbows will tell you this is the posterior side. You feel it now? Okay. Put your hands down. Let's touch it. Let's see here. Let's touch the ischium. Here's an ischium. Here's an ischium. Left ischium, inch higher than the right ischium. Sacrum. 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 High sacrum, low sacrum. You chiropractors that have been calling me up and texting me and emailing me and whatever, you know to find this. Okay? It's there. You have to find it. All right? So, bend this knee again. I don't know, 10 inches. Bend this knee again. 3 inches. How's the pain now in front?
It's not as bad.
Not as bad. But I haven't done anything yet. Except adjust occiput C1, C2. Interesting. So now let's make sure we're going to do this the right way. The anterior side I'm going to lift up with the wedge, like so. Bend this knee. Now, 8 inches. Bend this one. 8 inches. It's symmetrical. A little bit of twinge when I did that, but not bad. The next step is me taking this posterior, the whole pelvis, because it's rotated. This pelvis is rotated, swiveled, anterior. Okay? Posterior left, anterior right. So I use my drop table and I come right here and go down. The hemipelvis, like so. Take this out. Then I come to the ischium, which is high. So it's the hemipelvis. The ischium's up, okay? The sacrum is over, and the pelvis is rotated. You think you got back pain? How can you not? Especially when you're young like he and I at 60, man. You can't have these movements. So let's get the ischium. The sacrum. Tap it over. Now, I help with my knee. Because I believe if you don't use an assistant in your drop, you have to push too hard to initiate the table. So I get a better feel by, I snap it. I don't push through. It's a snap. And patient never gets hurt, although the table makes a lot of noise. The last thing I'll do is the ischium and set it. So now put your hand here. Now it feels even, doesn't it? Okay, he enjoys that. Okay, now look at his elbows. They're symmetrical. This one's up the same as this one. It's not flared out. It's not up here. Thank you very much. All right, now bend your knee. 6 inches, bend your knee. 4 inches. Not perfect, but better. Any pain when I bend your knees?
No.
Okay, let's go check the feet out now. Okay, now we got a left leg short. So let's check. Left Achilles tendon loose, right Achilles tendon tight as can be. Tender when I do that? Huh?
Yes.
How about here?
Not as much.
Okay, this is bad. This is less.
Okay.
All right. Let's flex the arch of the foot. Good movement here. Better movement on the left. So the left leg is short, right Achilles tendon tight. You got a fixation of the navicular bone right there, tender. And you people who are doing this adjustment technique know how much you find that right navicular bone. So get the navicular, get position. I have to flex it. You have to pull the heel back towards you. Okay? Setting the speeder board helps also. And then you just tap it. This is important. You flex it, you just tap it. It just shifts right in. Okay, the right Achilles tendon was tender. So we'll adjust the calcaneus down. Now we'll come back. Right Achilles tendon, a lot looser, isn't it?
Yes.
How about now?
Yeah.
What?
I don't feel much pain.
Don't feel much pain. So the compensation that's occurring all over this guy, Keith, because of what's happening in his spine, in his gravitational, his posture, I just corrected it and took pressure from the calcaneus. Okay, by dropping the calcaneus, I shortened the Achilles tendon. The calcaneus and the Achilles tendon kind of come together here. So if I lift up the calcaneus, I actually stretch the Achilles tendon. By adjusting the navicular, then dropping the calcaneus down, and the navicular frees the calcaneus to drop down. I then took the pressure off the Achilles tendon. So now, when he starts walking, his bad gait here won't throw his back out again. All right, let's check the big toe. Good. Tight big toe. On the right side, get that toe fixed. All right, need you to lay on your back, sir. Well, to me, I look at his face, that seemed easier. Was that any easier?
Yeah. It was painful, but still easier.
Painful, but still easier. Okay, bend your knee. Okay, internal rotation. Feel the pain in your groin? All right, external rotation. In his butt. Okay. Let's go to this leg. Bend this knee. Internal rotation. 10 or 15 degrees external rotation. A lot better, isn't it? So let's do the internal rotation first. Cock the table. Get under the pubic bone. Adjust it. So now we have internal rotation 50 degrees. Bend this knee. And we'll come to the external rotation side. And again, I help it with my body. We go external rotation and adjust the femur head down in external rotation. So now we have this. Still painful or less?
It's less. It's still painful though.
Okay. Any pain when I stretch?
No.
Nothing there? No. Any pain when I do this? Where?
Here.
At the sacroiliac and lumbar spine. Sorry about that. Let's do an axial pull. So he's got a lot of, Keith is corrected. He's in alignment, but he's got a lot of inflammation because this has been an ongoing problem for a long time. So let's do our structural stuff. When I pulled your neck, did you feel any pain down there?
No.
Okay, let me have both hands. Relax. Any pain when I do that?
No. Oh.
Any pain when I do that? Any click anywhere when I do that? Did that?
I clicked earlier.
A click where? In your low back? There? Good. So I did a decompression cervical stretch. I call it cervical traction adjustment. Then you do an axial pull with both arms out. Okay, he doesn't have a lot of shoulder problems. I did easy, and it stings the whole spine. You get a release at L3, 4, or 5, or even the SI joint. All right, now I need you to sit up for me again. I'm sweating because I have this light here bearing down on me, everybody. So well, you got it pretty easy. Huh?
I have to.
You have to. A little easier the first time though, wasn't it? Face down for me. Now see, people come in, they're afraid. It's been months, this guy, you know, and you can see as this film progresses where he's moving easier and easier, but it's hard for people to understand how they are. They remember how they were. How are you? Well, I don't know. You know, he's better. We can all see that. And his friend out there is going to convince him. Oh, by the way, this is a chiropractic adjusting glove. It's made by It's made by IMAC, the smart glove, and Xanacare and Company, Xanacare, and we'll give you that phone number. Had some special made after my design. Wrist support, thumb support, cushion support, piezoform support. Protect our extremities, especially the wrist. You chiropractors who do drop adjustments, if you don't have this, you're probably taking 10 years off of your life as a chiropractor using your hands and wrists. Tremendous, tremendous glove. I'm not hurt. I do it to stop from being hurt. I got this glove because I was hurt 6 months ago. So now we're going to go into the sacrum, and with that I can hook the pad right onto the sacrum base and separate it. Now, Keith, do you feel separate? You feel pull up in here when I do that?
No, I don't feel anything.
Don't feel anything. So I'm separating the occiput from L5, and he feels nothing. So to me, it's not L5S1, is it, Dr. Bill? You think? If he doesn't feel anything?
Yes.
Okay. Now let's go harder. You feel anything there?
Not really.
No. So I'm really pushing and stressing L5S1. Okay, let me do this at L5S1. Anything?
Yeah, it's starting to hurt.
Let me move, come up. How about here?
Nope.
L3?
Nope.
L2?
Nope.
L1?
Nope.
Okay, so all the MRI said L1 through L5, there's certain degrees of inflammation, degeneration, et cetera, each level, but I have a hard time producing any pain. Let's go to the sacroiliac joint. Tender?
Yes.
Yes. This is a sacroiliac lesion. Period. Okay, let's go over here. Any pain?
Yeah.
Worse here?
Yep.
Less here. So he has bilateral sacroiliitis. All right, I've corrected everything. He's still inflamed in the sacroiliacs. Let me get in and just rub these a little. But now he's nice and balanced. And it's interesting, in the SI joints I can feel those little nodules you feel, you know, when it's inflammatory. Let's rub these up a little bit. Nasty, huh?
Yeah.
So, you know, you have to be concerned he might have von Bechterews, which is the opposite of Maurice Strump-Pels, which starts in the pelvis. Or no, Maurice Strump-Pels starts in the pelvis and moves up, or von Bechterews moves up, moves down. So you should be checked out for maybe a rheumatoid arthritic test to see if he's got some inflammatory something going on. But it's not the herniated disc, all right? Let's do this now. Relax. You feel anything when I do that?
Nope.
Okay, let's go to the SI joint. You feel anything when I do that?
Mm-hmm.
And where my elbow is?
Right.
Okay. And this side?
No.
Nothing. Mostly right side. Okay, come on, get up for me and walk around. Now I'm going to do some laser in his right SI joint. Okay. It should be hurting when you first get up. Walk around a little bit. Notice any change whatsoever?
A little bit. I do right in here. Right in that area, right in there.
Right in the right buttock. Okay? On your back for me. Let's stretch that buttock muscle. And I bet you Dr. Bill's going to do fine tune and take all that away. Drop this one down. All right. right, come across. Now, is that the muscle that's hurting you right there?
Yep.
Yep. So let's just stretch this piriformis muscle for a while. Now, have you had your prostate or PSA checked recently?
Yes.
And is that normal?
Yeah, I'm fine.
Fine. Because, referred pain in this area can be from that area where there's the prostate, bladder. Oh, now you're stretching that muscle?
Yeah.
Okay, so now we have the muscular part of the whole thing. Structurally, he's good, but that muscle's on fire. So let's just stretch it. It's jumping. The muscle's twitching, saying, leave me alone. It's probably been out of balance for so long. It's constant state of contraction. It's all upset, so we're going to try to loosen it up. Is that all right? You want some leather to chew on or anything? Okay, come on. There it is right there, huh? Is that producing the pain? Reproducing the pain, Keith?
Yes.
Very much so. So in a very inflamed right piriformis. It's called piriformis syndrome, isn't it, Dr. Bill? Something like that? Oh, there it goes. I just felt the muscle relax a little bit.
Yeah, I did that.
You did too? Yeah, it just went kind of relaxed, gave in. I'm holding this here, so it just, the head where I'm holding just kind of, I felt it drop down into the belly. There it is. All right. So I would have loved to have dramatic results. Hey, I'm great. Number one, we found something structurally, fixed it. The piriformis muscle on the right has been completely inflamed. It's all upset. So come on up for me on 3. 1, 2, 3. How was it when you sat up?
I felt fine sitting up.
Felt fine sitting up. Swing your feet over. Give it stand up.
Feels a lot better, but it's,
Tell them.
yeah, it feels a lot better.
But it's there.
It's there.
Okay, so now we have a soft tissue issue. Soft tissue issue. And it rhymes. So I'm going to put a multiple therapy system called the Simulcare and laser. And the Simulcare does 7 therapies simultaneously. It also is made by the Xenacare company. This is the Simulcare machine. Red light, infrared, magnetic current, vibration, heat, microcurrent, and E-stim simultaneously. We're going to bombard the muscle with all these currents to increase the energy into the muscle, promote nerve flow, blood flow, and healing. Remember, he's healing inside out. This helps him heal inside out. Okay? And Dr. Bill's going to do fine-tune, see if I missed something. He's going to do it right now.
So we're just going to check Keith here and see if his neurological system is responding appropriately. Part of that innate intelligence to help heal. Sometimes when we're injured, there's a mechanism that's called switching where the brain doesn't figure out which side it's on. So we can get confused and send the signal to the wrong area, and it's not going to do any good. So sometimes we have to just make sure, well, we have to make sure it's clear, and sometimes it isn't. So we'll just see where we are. We haven't, first time I've touched him here. So hold this up in the air. It's nice and strong. I'm going to touch a spot here to check for polarity, and it does go weak, and it should. Right here, hold that right there. This is the end points of the kidney meridians, K27 on each side, and he goes weak. It should not. There's some sort of a neurological problem going on. Would you take your hand here and touch those 2 places for me? Real strong. Hold it. Okay. So I'm just going to try to find some area that's causing him to, and it seems to be this right here on this right side of the, his right SI or pelvic area there, and it is the SI joint. When I touch right on the SI joint, it shows that that's the problem that's going on. So, would you just take one hand on this side and one on that side, and you rub those places while I just stimulate this? There's basically, in simple language, a short circuit going on from the SI joint that's causing this confusion inside the brain, why it can't get all balanced out for these months that he's had this unrelenting pain. So we're just getting this short circuit cleared out with some extra stimulation from here. But then we have to kind of jumpstart the brain. Okay, let me just test this again now. Let go. Hold this up. And now when we touch this, it's clear. And all four quadrants and the head are responding. So can you line your back, please? Face up. Your head right here, yeah. Normal, just like before. So let me have one hand up here. But what I'm going to do both here just to show you the difference here. I want you to hold your elbows straight and the back of your hands together, okay? Hold those together like that. I'm going to try to pull these apart. You keep them tight. Okay. Elbows straight. Hold strong. See, there's just no strength here. And that's part of this. We have to kind of jumpstart the brain if you want to use that language. So just see which way the cranial distortion is. And when I push in these two directions, it goes weak. So let your arms relax. I want you to take 3 slow breaths, like 3 seconds in and 3 seconds out. 3 seconds in, 3 seconds out. One more, just like that. In. So as we get the skull loosened up, the meninges and everything relaxes and really helps to go along this whole thing. So hold this up now. That's good. And then we check to see if there's any kind of emotional or shock there. See if the body is in a he has a startled response here. When we just take the hand and make a claw thing right over the chest here, he goes weak. And it's more on the right side. So the simple test for that is in the toe, strangely enough. So don't touch your body anywhere, just keep your hands on the table. Bring this foot up as tight as you can, nice and strong. I'm going to try to lower this down. You keep it up real strong. Real strong. Keep it up. Trouble there? Where's is it?
Well, it's just can't hold it.
Okay, hold it one more time. Okay, let's try this one. Hold it strong. So this one is stronger. So he has some startle response on both sides, actually. Hold that right there. So the startle response is a problem in the rib cage. When we get startled, we lock together like this, and then when it's over, we let go. And he hasn't let go on either side. So he's in a constant state of hypervigilance, can't relax, neurologic disorganization showing up all over the place.
We've had a few players like that, haven't we?
Absolutely. Especially after some of the stuff that happens to them on the fields. Hold this up again. Now there's the difference here in this toe strength right now. Hold that right there. Now we have strength there. This one still goes weak. And we have to use this toe to find the spot. And almost bilateral. Now he told us earlier that when he was catching that softball, he was all twisted. His feet were going one way, his shoulder was going the other way. And it could have been from that incident way back. How many years ago was that?
It's about 10 years.
10 years ago. He's been having problem on and on and on and off. And for the last 2 or 3 months, it's been unrelenting. So we just have to free up these muscles that are holding this area so tight, and then stretch them all out. And come down here and check this again. Hold strong. That one's strong. And that one's stronger. There's still a little bit of weakness. Let's just check the startle response test. Hold. And now when we do that claw thing, that's clear. So hold this up in the air for me. Strong. Good. And we have this one. Hold. Both at one time. And that's good. Just leave your hands at your side. Hold this one. Hold strong. Hold. Hold. And he's showing to have a facet there on that side, but it could be the SI joint too. So we just need to rule that out. Hold strong. and it seems to be facet more. So that L5, S1 area.
So by touching the facet, then touching the muscle got weak, which confirmed it was the facet rather than the SI.
Yes, right.
Okay.
May I have that? Thank you. Let me slide this under here. So we're just going to put these blocks under L5, and then if we do this test here, and it's now strong, that confirms that it's that level. So we're going to give this is the imbrication that I'm going to give a nice little release here. There we go. Felt that.
Did you feel a click?
Yeah.
Nice little click where the facet opens up. I'm not here because I want to be in the video, so we only have one microphone, so I want you to hear Dr. Bill.
So now when we do that with nothing underneath there, it's strong on both sides. And when I touch, hold this up, when I touch that L5 area, it's clear. Now keep that right there for me. The SI joint, Dr. Desjarnatt's work with the SOT, there's the arm fossa test to determine sacroiliac joints. And it's showing to be clear right now, but we know it's all inflamed, and that was the original site of the neurologic disorganization too. So we just got multiple areas released on the whole thing there. I think that's all we can do. We can use the therapies now.
Now let me add, are we filming, Jerry? Let me add what I said before. We all do different chiropractic. We got into chiropractic school, became a chiropractor because we wanted to do non-drug therapy, non-toxic polluting therapy on human beings, dogs, animals, whatever, and learn what's best for us, our specialty, our talent, our gift, our skill. And everybody has somewhat of a different skill. As you can see, Dr. Bill's skill is different than mine, but he's great. My skill's different than him, but it's okay.
He's great.
It's good, okay, it's okay. Combining, okay, we insist on it. Why? It's the best and the most we can do for the patient to get them well the quickest possible, period. If you're just doing one little thing, you might get the patient well, but can you do more? You love them. They're part of you, okay? We're all from the same energy source, okay? Do all you can, or feel guilty that you don't, because it's wrong. Do all you can to get them well the best and the quickest possible. Stand up for me. Walk around. Now he's going to be sore because he's been laying down for a while. Just move it a little bit though. You're still inflamed.
I was telling him earlier that it feels like I have ankle weights on.
Yeah, he feels like he has ankle weights on. So, for something he's had for 10 years, unrelenting for the last, 3 months? Did you get some improvement?
I feel a lot of improvement.
Tell the camera, please.
I feel a lot of improvement.
Okay, and this guy's been in misery, man, misery. So thank you very much, Keith. We have to see him more, of course, but I want him 100% well, 10 visits out of here telling everybody. I don't want to see him more than 10 times. I want him to send me people that I can each see 10 times.
Amen.
Amen. Bless you, brother.
God bless you.
All right. Everybody, this is Keith. Walk around, please. Move around. You saw him a couple days ago when he was excruciating pain and couldn't walk. And now, how you doing today, man?
Feeling pretty good.
Yeah, walking good, not limping, sleeping.
Good. Sleeping all right.
80% better? 80% improved. 2 visits.